Welcome back to Miss Brightside, the Power of Positivity podcast. And we're on part 2 of my mother's amazing journey from Knicker factory to clinical nurse specialist. So she's telling you her story. And the reason why I've got her on my podcast is because she's such an inspiration for her career, her learning journey, and doing a degree so late in life. And it's just to put out there to anybody, you can do whatever you put your mind to. We are on going to the wards. You've done all your training, you've gone from Knicker factory to your training to the wards then, if I've got that right, or your ward training. So
yes,
tell us all about that.
I always say, and I say it now because things have changed so much, that I think I went into training at the right time and I came out of nursing at the right time. At the time, when you did your training, you were a really big part of something. I'm not sure how many came into training with me, but one in particular that I did meet was Sue Clifford. Is that she lived in the Gurness and I lived in Galnachaf, and we used to walk because we didn't have no cars, nobody to take us anywhere, so we walked down through Goitra Lane. If anybody knows the Gurness, they know the Goitra Lane. So we used to walk every morning down the Goitra Lane, down to Gwelydd y Garth to our training, because we slept at home. Students had to sleep in. For the first year of their training, they had to stay in rooms. As with pupil nurses, we could go home. So me and Sue used to go, and we've, to this day, still wonderful. She's one of my soulmates today. But, you know, we used to walk, and at the time, they had just brought out these new shaped baskets, which was like a square basket, put on your arm, and it looked like a farmer's market basket. But me and Sue used to put all our books in it to carry back and forth to the
You still
school.
got that in the attic, haven't you?
I've still got that, yes. And it had a plastic cover for it, so you could just slip your hand under, because of course everything would get soaking, because walk you did, whether there was raining.
Oh, so you had a protective plastic cover for it?
Oh, yeah. Quite fashionable.
Oh,
yes, to have a cover for it. But and it was very, very heavy. And when you because you didn't know what subject you were going to be actually doing that day, you take all your books with you.
Oh, it's a bit hard, isn't it?
Yeah, but it was okay.
Did you have to buy your own books?
Oh yeah, I had to buy our own books. Yeah,
okay.
I had to buy our own books and had to buy everything. But one of my aunties, my father's sister, Auntie May, she was very, very good. She had 4 children herself, and her 4 children never wanted to do anything in life. Their dad was very restrictive, but my Auntie May was a fabulous person. Her and my mum were like sisters rather than sister-in-laws. They had a fabulous relationship. And in our family, my sister went to London with Kaiser Bonda to be trained up to be a machinist, a specialised machinist, which I did realise for years. So she was in London very early in her life. My brother Kenneth, who was the next door up to me, went to the Merchant Navy. So he went and did his thing and travelled the world in the Merchant Navy. When I think about it, we were all quite...
And Philip, an apprenticeship, did he?
Philip, no, he went into a shop and he was training to be a bit of a butcher in the back.
I didn't know that.
And they were training him to be a butcher and things. And then he worked on the shops and he worked at different places. And eventually, again, late in life, trained to become like a gardener. He was one of the ones that went into management.
Like a management.
I think the whole lot of us had something somewhere, but we didn't start out with something.
But you all started off on little different paths.
My Auntie May bought me one of my books. It was something like 10 and 6 for a diary, which was a lot of money then. So I've still got my books today.
I didn't know you still had them.
I still have my books today, and I still have my name in it, Pamela Stevenson, as I was then, which I loved. I've always loved my name. So my auntie helped, but my mother was very, very good. I used to earn £15 a week in Kaiser Bonda, and then when I went nursing, I was having £24 a month. So it worked out to £6 a week.
It makes no... When you think about what you just said there, you can see why people stayed in factories.
Yeah.
I know it's all about, and it still happens today, innit? You take a wage cut for the end goal of a higher wage long term.
Yes.
But when you're young, and let's be honest, we're all money orientated because you want to go places and do things, like to go from £15 a week to £24 a month is wild, isn't it?
It is wild. And I used to give my mother, the things of those days was you brought your wages home and you give your mother, say, a third of it, and then the rest was yours. Well, when I was earning £15, that was fine. But then when I was earning £6 a week, so I'd give my mother £2, and by the end of the week I would have had it back. My mother was wonderful. I never had to ask my mother for anything. And I always remember going out shopping and I fancied this green leather coat and she bought it for me. And that was a big memory for me because that was a lot of money at that time. My mother was never mean with money.
Yeah.
And she always encouraged us and she was so proud. And my dad, who I lost when I was in my 20s, he died at 52. My dad was immensely proud of me. I mean, I don't think anybody that ever met him didn't know that he had a nurse for a daughter.
He told everybody. He shouted
Every
about
single person. And my mum. Anyway, going back.
Yeah.
So we had to buy all our books and everything. So everything we had to buy. There was a library, but not very good. But it was quite a proud moment when you had your books because they were yours. So when you did your essays at home and different things and you wanted to look up, they were yours and they were there.
Yeah.
So you could use them.
It's still a bit like that now. Like there's good libraries and different things like that. But it's so much easier if you've got that book you can take it with you, can't you? We're at a total different age now where there are so many books online, e-books and all of that. So it's just and research online is totally different. But like even when you talk about 10 years ago when I was doing my, or was it 15 years ago when I was doing my HR things through work, they had all the books available, but it was much more practical to buy my own.
Yeah.
So I could have it next to me while I was typing up my essay.
Yeah.
Whereas we come probably 360 now, they still got libraries in unis and consider them all right. But the research online is so massive now.
Massive. My first ward, I think, Matthew Ward.
How were the wards named then? Because
they were all named. I think St Idris, there was Matthews, there was Mark, there was Luke. There was
that would make sense. It's Bible names.
Bible names. Luke.
I know Bible's the right word, but yeah, it's Bible names and everything. Names of the Bible.
Luke's ward was Mr. Jen, so there was a Luke's ward and the Berry ward. But Berry was named after the business person who paid to have that Berry ward made. It was an annex.
Okay.
So the wards were usually named after the people
who paid
for them. So we had Berry ward, we had Sandbrook ward, we had the children's ward, and then we had Buckland ward. And Buckland was Lord Buckland was the owner of the big business at the time and built Mercer Jen.
So you say big. What do you know what he did as a businessman?
I can't remember.
I
but
just wondered.
Yeah, but
he's a big businessman.
Oh, big. They were big Merthyr people, big businesses, and put money into it. And when you looked at Merthyr Jen, nursing training thing, and a hospital, it was in two parts. The top part was very much the older part, and the bottom part was much built the same way. But the middle, which was Bury and Sandbrook, were added on. So there was a long, thin corridor going from the one part to the joining to the other one, which was freezing cold in the winter and boiling in the summer and very, very eerie in the night.
Oh, God.
It was lovely, but the old-fashioned wards were so warm and cold at the same time, but they were like big, and our wards were all 18-bedded or 30-bedded wards. You walked in and there was the beds down either side, and you had cubicles, which is where you put your illest patient, or they thought they were paying, they could go in there. Or if they were very nice, they'd go in there. And then the beds would be literally so many inches apart.
Like really regimented.
Really regimental. Curtains coming around each one. Curtains were classed as walls. I mean, you could hear every little breath from one curtain to another. You could,
no patient confidentiality.
No, if you were, a doctor was telling you you had cancer, you know, the whole ward knew. Because even though he may have talked very quiet, everybody was quiet because it was a doctor's round.
It's the gossip.
Yes, so you couldn't keep anything confidential. But the wards were lovely. I'm saying that, the wards were lovely, easy to
So manage. What type of things were you training? So when you went on the wards, what type of things were you learning then? So you've done all your bed etiquette, you've done all your, like you said, your blood pressure checks. So what was the next step when you were on the wards? What were you learning?
They were learning the conditions. So patient one might have been, she had an appendectomy. So you would learn all about appendectomy, what it was, how they removed it, and what the nursing care in the SEN's world, what nursing care they needed.
Okay.
So everything was based on nursing care, but you had to know the condition to know how to nurse them.
Okay.
Obviously, we changed it slightly for different ages, different people. And then, of course, the next bed may be a gallbladder removal. So you had to learn all about the gallbladder. So you were learning your anatomy as you were working. So you learnt that the gallbladder was situated where, this is what his job was. So then the next bed then could have been anything, a breast lump or something. So this is how...
I guess, in the surgical ward
This was with the surgical ward, yeah. And if you went to the medical wards, it would be diabetes, it would be heart attacks, strokes, and things like that. And then, like for a stroke, there could be many, many reasons why. And then the rehabilitation of the patient, how bad it was and how they left. Because, I mean, then, if you had a stroke, there was no treatment bar coming out of it. Now, if you can get the treatment within an hour, you can be almost reversed from a stroke.
What was the most... This is what I find super interesting. Like, what was the most common ailment? Did you see a transition from when you were training to when you finished nursing? Was there a more common, like, I'm making this up now, but you seeing linked to weight loss jabs at the moment, like gallbladders are just, people's gallbladders are going. Was there something you noticed that it got less and less common the more you nursed?
No, I think like medicine was always heart attacks, strokes, diabetes, basically around there, and respiratory, because we come from a social area of miners, so we had a lot of respiratory problems. So it wasn't a matter of curing these respiratory things, it was a matter of just making them comfortable for the patient. So yes, there was a change in that, in the sense of when these began to pass away, then we didn't get them with that condition then.
Okay, so you had a lot of historic, like
yes,
said, miners with miners. Is it called miners lung?
Yeah.
Our grandpa had?
Yeah. Collier's pneumocoliosis, it was called. Pneumocoliosis is where the coal dust gets into the lung and it causes you've got little airbags called areolae, and they expand and contract, and that's what sends the air through your lungs, and the coal dust used to clog them up so that they couldn't do that. And that's why they couldn't breathe and they have a shortness of breath. And that's why they couldn't cough up what was there, because they didn't have the breath in to get the breath out.
Okay.
So that was very common. But yes, there was a major difference to what I started with to what I finished in nursing, because I specialised in gynecology eventually. There was a major change in that area. But in every area, like if you had a breast lump in the 70s, you had a mastectomy. There was more lumpectomies.
Right.
If you found a lump, your breast would be off.
So there was no testing, I assume, then, back then? So
no.
It could have been a benign lump, a positive lump. You wouldn't have known.
No.
You just had your breasts off.
Mostly, but not always, but they could tell, and they could tell when they went in. So you wouldn't always come out with a mastectomy, but if they thought... But then we didn't have the diagnosis so easy then. So we didn't have we didn't have mammograms, and we didn't have any of this. So patients, being women at that time, they wouldn't go to the doctor with a breast lump because it would be like normal. Right. So that breast lump would eventually get so big that it couldn't be treated. And then she'd go to the doctor and say, I've got a problem. So everything really and truly, because they didn't have what we call now screening. If you didn't find it yourself and go to the doctor, sometimes things were way beyond treatment before they got to the doctor.
Yeah.
So because you didn't have cervical screening, you didn't have breast screening, you didn't have testicular screening, nothing. So there was nothing as a prevention. So everything came when it was there.
Yeah, okay. So you talk about like cervical cancer. How would I know if somebody had cervical cancer back in the day? They'd obviously do a speculum and look, and they'd see the cancer then if it was that bad. Yeah,
usually because especially smears have developed tremendously, fantastically now. I'm pleased if you need a smear, go and have a smear.
I know. We'll talk about that again, because you're so passionate about it, so you should...
But somebody would come in, as a lady would come in, and she would go to the doctor first, and she'd more than probably say that she was bleeding. And one of the things we always took very much notice of is if they bled after intercourse, because obviously there's something in there that was being touched and bled. So it was an indication. Not always, it could have been something hormonal, because there again we got hormones involved with that. But it was, like I said, they turned up, and usually like we were dealing with things that were very advanced.
That's what the difference was then. It was much more advanced.
On one of my wards, I think it was the first ward that I went on, and it was surgical and no names. And we had an elderly lady in, and her breast was what we would call fungating.
Okay.
It was, the cancer had eaten completely all the breast.
Oh, God.
And you could smell it, you could see it, and then when you dressed it, it would run with blood and whatever. And this was all because she didn't want to go.
She was too embarrassed to go.
And we had very few female doctors, and then it was, I can't show my breast to a doctor, so I can't do anything. This is what we had.
This is out, we've gone from that, hopefully now to, and still people embarrassed to this day, especially with, and this is why you're on, and we'll talk about this maybe in another episode, but why you're so passionate about female and women's health, because of, we should not be embarrassed anymore, because we should,
no.
And like all of these different things, because there's been women in your life that you've seen, like her, that have suffered where she didn't need to suffer. But then I get socially, maybe, so what was it, the 70s? And you had like I said, an elderly woman, which I assume would have been...
Never showed her breast to anybody and her husband.
So that's why she was so embarrassed. So look how far we've come in medicine now to be able to be all Googling now, which is nasty. But, you know, from that perspective. So they were the type of cases that's what you've seen when you're on the ward. So what happened then once you got your training?
So it was almost, and like doctors today, you train from what you do. So every time that you do something new, I mean, my first injection into an orange was horrendous. I mean, how could I pierce that skin with this needle? It was a fear. Oh my God. But we learnt, and that's how we learnt on an orange, a syringe and an orange. We were lucky when I started nursing in the 70s, we had disposable needles. Before that they didn't, and they used to have to sharpen the needles and sterilise the needles to be reused. So it was revolutionary when we had disposable needles. So it was much, much easier. The
tube was still metal then, was it? You sterilised the syringe. The syringe. Or was the whole thing by the time you got there disposable?
I think it was a bit by bit, but I can't remember a lot of reusing. I do remember most things starting to become disposable at that time. Very few things had to be re-sterilised. We did have all our like artery forceps and dressing forceps and everything that we used in dressings and everything were always re-sterilised. We used to have what we called an autoclave. So we used to put that on, boil it up, put our instruments in, obviously being scrubbed and cleaned, put them in, and then time it, and then when that was finished, then put them into something, and that they were ready for use. Were ready for use. One day in my training, I shan't say where it was, but people who were listening, if they knew, they would have known. On a Sunday, we used to have, because it was a quiet day, we used to have boiled eggs and toast, and the eggs came from a local farm. So we used to put the eggs in the steriliser to boil.
I love it.
So it came in useful for both things.
For cleaning instruments and boiling eggs.
I totally loved my training. I loved wherever I worked. Very, very anxious. Every 8 weeks you'd move from one ward to another. Your training was mapped out for you. Your tutors, you had a tutor, and your tutor would be very aware of where you were and what you were doing. And then in between, in the 2 years, we would be on the wards, then we'd go in for what we called a block, and that block may be like surgical. So after that block, then we'd do the surgical wards.
Did you ever get to see any surgeries, or would it just be...
No, we went to theatre as well.
Okay. How did you find that experience going into theatre for the first time?
Theatre's petrifying, so sterilised, and you had to be so clean yourself, like you were in scrubs. Well, it wasn't scrubs then, it was dresses. So, but you would go into this dress, you had to scrub all the time, and you didn't have a hat on. You had to keep everything back. And as a pupil nurse, we weren't encouraged to do very many things. We were like the cleaners of the theatre. We seen things if they called us near, but the students were called and they would hold a thing and retract and do everything, and they'd scrub up for things, as it wasn't necessary for us because we were classed as the ones who weren't going to go anywhere, apparently. Yes. From what you said at the beginning, you could only get your S. Yeah, we were only looking after the patients. We didn't need to learn why they had it and whatever. We just learned how to nurse them after surgery, because then it was more planned surgery than emergency. You would have an emergency, but every day your theatre would be like open from 9 till... They would have lists, so you'd have an orthopaedic list, and you'd have a surgical list, and you'd have whatever, so each list, and then in between each list the theatre had to be scrubbed, so everything would come out, everything would be wiped down and
so
come out.
that's what you'd go in and do, the scrubbing down in the theatre?
The students used to help as well for that.
Okay.
That was part of their job. And you'd wash the walls, the ceilings, everything. You'd have wellies on, everything had to be washed. It was a tiled room, which was spotless.
Yeah.
And you had a dirty area and a clean area. The theatre was a clean area. And you had a dirty little area, which is more like a utility today, where everything went after surgery. And then everything was cleaned before it was re-sterilised. So they did have that distinct division. So no, your training could be, that's the nice thing, your training could be anything. You go in one day and you'd see one thing, and you go in another day and perhaps the patient wouldn't be there, perhaps they would have died in the night or done whatever. And you get very close to patients because the visiting was only a certain time and it was like an hour a day.
Strict as well, isn't it?
Very strict. But the patient care was 150%. The patients were very cared for. They didn't have to do very much for themselves. We, and I say we as nurses, we made sure that they could reach their food. As today, the dinner's put on the table, on the bedside table, which may be half a mile away, and nobody would think about pushing it up. Yeah. So at the end of the day, when they came to collect it, they'd collect it, not realise they hadn't eaten it because they couldn't have the chance to, because they were up this end and the food was that end. Yeah. We would put the food, we would bring the trolley, we would put the food, we would, if they needed it cut up, we'd cut it up for them and whatever. Yeah. And we also observed then how much they ate, if they ate it, and it all helped with their treatment and their care, because if they didn't eat properly, then they'd have wind and they'd have different things. So it was all connected. Yeah. Very much. We use the term holistic care today. Yeah. It was very holistic without the word holistic put to it.
Yeah. It was more, from what you've described to me, you did a bit more of a 360 training. You didn't just learn how to, do a catheter and inspect the stitches to see who's infected. You had to go and clean that theatre, and you understood why they clean. You seemed to do more of a 360 training, so you knew more of
why you had to keep the theatres clean because of infection.
Because of infection. Yeah. But not just that, like I know it's very different now, but you did like a bit of an apprenticeship, like on the job training nursing.
Yeah, very much.
Because there are some nurses out there, and lots who are excellent and go out into wards now, but then they might have never actually seen, before they've gone on their rotations of learning, a surgery before, and actually think, oh my God, I've just signed up to a nursing degree and I actually can't cope with watching somebody put a stitch in, I don't know. And then you've got the others who are right in the thick of it and love it. Yeah. But from what you've done, you've had that more, that broad training basically to allow you to, which you did in the end, to specialise in sexual health and being a clinical nurse specialist from that way, isn't it? Yeah. Was there any funny stories from the wards, any funny characters you met that have stuck with you forever? Or?
Oh, yes. I mean, when we used to work in St Matthew Ward in St Titvilles, it was right next door to the OP chocolate factory. Okay. It was a little backyard thing from there. And they used to, Easter time especially, Christmas, and throughout the year, if somebody from OP came out for a cigarette and one of the nurses was out doing something, and they'd say, have you got any chocolates? Over the wall would come bags of biscuits and chocolates and God knows what for the nurses. Yeah. So it was funny but lovely and things like that. Yes, we used to do strange things. It was and one of the sisters in St Titvilles, there were two wards shared a kitchen. So everything would be shared. They'd have their own, but it would be brought out for their own ward. But the one sister had to have everything everybody else had. Yeah. I mean, you couldn't bring it out. So if you brought out sugar and put it in the bowl, you turned your back to put the sugar back in the cupboard, the sugar in the bowl would have gone, because she would have put it into her bowl because she needed it. She didn't, but she did. Yeah. So that was Betty Humphreys, and Betty Humphreys was the sister, very good. I think she started training. She could have been a doctor. She was extremely educated. Yeah. But a kleptomaniac.
Oh, so she collected things.
Food.
Right.
Or bandages or anything that was available.
Anything was angry about, it was hers.
It was hers. And I remember the one sister then one day went down, we used to have a changing room and they had their own changing room. And the one sister said, I'm getting dressed and I'm crunching on sugar that I know is my sugar that she's put into her locker to hide. And she said, that's when it gets me, is when I'm crunching my own sugar and I can't get it. And she'd have butter and everything. It would go rancid in the end, but she had to have it.
She had to have it in her locker?
Yeah, and on every ward, I think this is another thing nurses in my era would know, we had what we called a donkin. Right. A donkin was the cupboard in the middle of the ward. It was a big cupboard and it had a big wooden top and it had cupboards all on the side, and in there we would keep linen, we would keep bandages, things like that. Everything we really needed to keep in the ward would be in the donkin. And on the top of the donkin every day would be the flowers that we would bring back out. We'd take them out every night because of course then it was says that the flowers would take the oxygen the patient needed.
Oh, right, okay.
Yeah, so you couldn't leave the flowers out all night into the ward because the patients needed that air
and
the water.
Of course they needed the oxygen.
So the flowers had to go out every night into the bathroom. You couldn't have a bath in the night.
Right, okay,
even if
so
you
all
wanted
full
to,
of flowers.
because it was all full of flowers. And then you change the flowers in the morning and took them out and put them
So
on.
you change your flowers, you change your water in the flowers?
Every day, and rearrange and throw out away. And every
so
day
basically you became a florist?
Oh, definitely. Yeah. And you come out every morning, who's are these? And there would be at least 3 patients who would claim 1 vase.
Right.
Yes. And if there was a patient in who didn't have any flowers and somebody had 4, then you'd give them 1.
Right.
You know, it
to
wouldn't
make sure
be a
they weren't
problem.
left out.
But they all went on the donkin. And the donkin, if anybody would hear from years ago, they all would know what a donkin is.
Yeah, that's what your key kit is.
Yes, it's a big cupboard in the middle. When you look on any old photographs, black and white, of wards, there was always a cupboard in the middle of the ward, and that's a donkin.
Well, I think that's where you've got your obsession for sorting then, because you love a box and you love a cupboard,
so
that would make sense. All the bandages would be in one drawer. And you loved the little stock taking an organisation of a cupboard, so that makes sense.
I knew what everything was. No bugger else did, but I knew what everything else was. There was funny things. I can't think of them at the moment of what happened, but we had many challenges and many laughs as nurses and patients. Patients, we would encourage the patients and we would do things with the patients we were supposed to do, but the patients, they lived in hospital rather than survived. They actually had a bit of a life in hospital rather than survived. They were, again, looked after. All that was my training. When I qualified, we didn't have to apply for jobs then. We didn't apply for, I want to go to surgery, I want to go to this. Whatever the position was, you were placed. So when I became an SEN and I became qualified, I was in St Tidwell's and I was informed that I was going to be nursing in outpatients. So that was going to be my thing, and I thought, oh, that's all right, I'll have weekends off and whatever. But about a week before I was due to go, they said to me, we're going to put you on gynecology, which is St Bartholomew's ward, which was known as St Bart's ward at the time. And we're going to put you there for a couple of weeks because they need staff. I spent 27 years on gynae.
And the rest is history. So you weren't planning on, right?
I didn't plan to go to gynae. I was going to be put on orthopaedic in clinic, in outpatients.
And you stayed with gynae ever since? I didn't realise that.
Stayed with gynae ever since, I was put there and for some reason, and the other thing was, which was quite strange, I had never done, as pupil nurses, you never did gynae. It wasn't classed in your curriculum. So when I went to gynae as a qualified SEN, even though I was qualified, I knew nothing about it.
So how did you learn it all?
Again, repetition, going to do it, good staff on the ward. But we didn't have a lot of staff on the ward. It was only a 12-bedded ward. It was a beautiful little ward. It was a well-run, lovely little ward. Obviously all females, being gynae. And that's what kept me in the female. I never nursed many men in my life. It was only in my training. And I didn't do a lot. I think I only did about 4 wards of men then. In 2 years. So my training has been mostly all women.